Hey man, today I'm going to answer the question, what is ED really? I'm going to talk about the biggest mistakes men make when thinking they have erectile dysfunction, the biggest mistake they make when trying to fix their ED, and treatments they may be using that are actually making this situation worse. Then as an added bonus, I'm going to talk about how to easily address this naturally and holistically in a very simple manner. Now, if you're interested in learning more about how to fix erectile dysfunction naturally and holistically, please hit the like and subscribe button, as it is your vote telling YouTube that you want this kind of content, not just medical treatments for erectile dysfunction. So, what is ED? ED, also known as erectile dysfunction or impotence, is the persistent inability to achieve and maintain an erection firm enough for sexual penetration. With over 52% of men reporting having erectile dysfunction today, it's very important that we understand how ED works and how to resolve it. So it is critical that we understand what is ED. We are experiencing an unprecedented amount of impotence in the modern era due to all these modern day alpha inhibitors that our grandfathers never had to deal with, like chemicals in our food, EMFs, high-speed internet porn on demand, just to name a few. Erections and male arousal is a complex process that involves the body, mind, and emotions, and include things like the brain, hormones, erection biochemicals, anxiety, stress, relationship problems, prostate issues, nerves, muscles, fascial restrictions, and blood vessels. It's an ecosystem that needs to be addressed holistically at the source rather than just treating symptoms in isolation, which is why many men get little to no results when trying to naturally resolve their ED, because they're trying to address their symptoms in isolation rather than addressing the source of the issue as an integrated ecosystem. ED is a dysfunction, not a disease, yet it's often treated as a disease through medications and surgeries. This is a very important concept when we are trying to understand what is erectile dysfunction. A disease refers to a specific abnormal condition that affects the body or mind and often requires the use of more extreme treatments, such as medication or surgery. A dysfunction, on the other hand, is much less severe. A dysfunction simply means that something is not working the way it should and typically does not need medication or surgery. ED stands for erectile dysfunction, not erectile disease. However, it's important to realize that disease can cause erectile dysfunction, which is why it's important to get yourself checked out by the doctor if you have ED. Diseases like heart disease, high blood pressure, metabolic syndrome, and diabetes. So if you have ED, you need to get yourself checked out by the doctor to make sure you don't have a disease causing it. But this doesn't mean you necessarily need to take any ED drugs if that's what the doctor recommends, as it's completely possible to turn this around naturally and holistically, which we will talk about in a moment. But if you have a chronic disease, you need to know that so you can address it, because it's not only affecting your erections, but your overall health in general, and can be potentially fatal. Erections are the barometer of a man's health. If you aren't getting regular rock-hard morning wood or 10 out of 10 erection hardness on a regular basis, regardless of your age, your health as a man is suboptimal. Now, what are the risk factors and causes? There are both physical and psychological factors that cause and contribute to impotence. Medical conditions like diabetes, heart disease, high blood pressure, kidney disease, multiple sclerosis, Peyronie's disease, prostate-related treatments or surgeries, depression, and obesity can all cause or contribute to erectile dysfunction, which is why you want to get yourself checked out by a doctor, even if you are addressing your erectile dysfunction naturally, as these medical conditions can be life-threatening, so you need to know if you have them so you can address them effectively. Also, spinal injuries can cause or contribute to ED, damaging the nerves that innervate the penis. Physical trauma and surgeries can also cause vascular damage, which can decrease blood flow to the penis. Poor gut health, which leads to leaky gut. Leaky gut is when the gut is inflamed, which causes its tight junctions to break apart and allow particles such as food particles and bacteria to leak into your bloodstream, which then can cause erectile dysfunction. This leaky gut can cause erectile dysfunction through two different mechanisms. First, it causes the immune system to kick into gear because it sees these particles that leak from the gut into the bloodstream as foreign invaders. So the immune system kicks in to eliminate these foreign invaders. It simply has to because your body's first priority is to keep you alive. Its second priority is for you to reproduce. If you're not alive, reproduction is inconsequential. It's not even an option. So when your immune system kicks in, your body prioritizes healing you and keeping you alive and deprioritizes reproduction, making it much more difficult for you to get and maintain erections. So as your immune system ramps up, your testosterone levels tend to go down and your blood flow to the genitals becomes compromised, which is what makes it more difficult for your body to perform in an intimate situation. Second, those particles leak into your bloodstream from your leaky gut, causing inflammation in the blood vessels. This inflammation can cause damage to the endothelial cells of your blood vessels, which then cause those blood vessels to narrow by the breaking of the tight junctions, which then starts the process of developing plaque in your blood vessels, also known as atherosclerosis, which greatly decreases the amount of blood flow that can get through your blood vessels, thus making it more difficult to get and maintain erections. Now, there are many things that will irritate the gut and cause leaky gut, like seed oils, gluten, and processed foods. But ironically, one of the biggest offenders is ED drugs. ED drugs are very rough on the gut, inflaming it and causing this leaky gut issue, which then actually makes getting natural erections much more difficult, which is also one of the big reasons why ED drugs stop working over time. So ED drugs are not just a band-aid that masks the problem rather than actually solve the issue. They actually do damage to the very system that allows you to get erections naturally. That's why if you want to put erectile dysfunction in your rearview mirror for good, you need to address the ecosystem behind your erections so you're getting at the source and not just trying to address the symptoms through medications. That way you can literally be rock hard for life rather than constantly chasing magic pills and band-aids to mask the problem rather than resolve the underlying problem. Now, ED drugs are not the only medications that can cause or make erectile dysfunction worse. Some of the main medications that have erectile dysfunction as a side effect include blood pressure medicines, anti-androgens, which are used for prostate cancer, antidepressants, tranquilizers or sedatives, appetite suppressants, ulcer medications, and antihistamines. Also, lifestyle factors like smoking, drinking alcohol, poor diet, lack of exercise, as well as sexual shame and sexual trauma can all cause and or contribute to erectile dysfunction. Now, how can you tell if you have ED and what are the treatments typically prescribed for it? One of the earliest signs of developing erectile dysfunction is weak, inconsistent, or no morning wood, also known as nocturnal penile tumescence. If your body is no longer getting morning wood, then there are some physical causes of your erectile dysfunction, such as poor blood flow and or hormonal imbalances. It's very important not to ignore the decrease in your morning wood, as it is often the first sign of impotence developing. This is called organic erectile dysfunction. Now, some men have great morning wood, even great erections during masturbation, but experience impotence when they are in the bedroom with a partner. This is indicating that the issues are more mental and emotional in nature. This is called psychogenic erectile dysfunction. However, what I have seen over the years is that this is rarely this straightforward. Most men with ED are experiencing both organic and psychogenic erectile dysfunction, which is why it's so important to address the entire erection ecosystem behind your bedroom performance. For instance, if you're having weak morning wood and then go into the bedroom and have an erection failure, then you start doubting your ability to perform, which then becomes performance anxiety, and now all of a sudden you have psychogenic erectile dysfunction as well. This dilemma can be easily resolved by addressing the ecosystem behind your bedroom performance, which I will talk about more in a moment. But first, let's talk about the treatments that are typically prescribed by a urologist or medical professional. Most men report that as soon as they mention erectile dysfunction to their doctors, the first thing they do is prescribed ED medication, which includes Viagra, Cialis, Blue Chew, sildenafil, tadalafil. The problem is that these medications often lead to the leaky gut mentioned earlier, which can lower their testosterone in the short term and damage the blood vessels for the long term, which causes these ED drugs to stop working over time, in addition to the fact that the body habituates to them. These lower testosterone levels not only make it more difficult to achieve erections, but also show up as low testosterone on your blood tests. Often, when these low testosterone numbers are seen, patients are often then put on testosterone replacement therapy, or TRT. This often creates a new problem because the artificially injected testosterone causes the testicles to stop producing its own natural testosterone. So the testicles start to shrink and lose shape. And the insidious thing is that once you go on TRT, it's very difficult to come off of it as your body loses its ability to create its own natural testosterone. Also, like any medication, TRT has side effects like increased prostate size, heart failure, blood clots, sleep apnea, and small mushy testicles. If you're on TRT for a while, your body may lose its ability to produce testosterone altogether. Then you're completely dependent on TRT for the rest of your life to feel or function like a man. ED drugs also have certain side effects like headaches, facial flushing, gut and reflex issues, heart attacks, and stroke. Now, once the ED drugs stop working, typically the urologist will put you on trimix injections. Trimix is a cocktail of chemicals that you have to keep refrigerated, and then you inject your penis before every intimate encounter. Just like any medication, trimix also has certain side effects. For instance, scar tissue forms at the injection sites and can produce something called Peyronie's disease. Peyronie's disease is when there is an abnormal curvature in your penis that is often painful and can cause erectile dysfunction. It is caused by the scar tissue pulling on the penile tissues, creating that curve. Also, a frequent complaint of trimix users is the lack of spontaneity, as they have to have access to their refrigerator in order to get the injection. Many women also complain that they don't feel desired by their partner due to the fact that their man has to inject himself with a very powerful set of chemicals to get hard enough for her, often creating relationship problems, which then frequently causes the man to start hiding the trimix injections or ED drugs, which makes him feel even more inadequate and emasculated. Once the trimix stops working, the doctor will frequently recommend penile implant surgery. This is where they cut into your member and splay it open and insert an inflatable device that you pump up by squeezing a third testicle that they insert into your scrotum. This surgery is irreversible and permanently damages the main blood chambers in your penis, called the corpus cavernosum, which means that you will never be able to get naturally fully hard again. And unfortunately, you can't get fully hard with the penile implant either because it does not get the head of your penis hard. It stays floppy. Once a penile implant surgery is done, it's very difficult, if not impossible, to ever get naturally rock hard again. And those penile implants have to be replaced every decade or so, meaning more and more surgeries, which increases the risk of penile infection and amputation every time they're done. Now, what about natural solutions? As Harvard's Dr. Michael P. O'Leary states, erections serve as a barometer for a man's overall health. So if you're eating healthy, exercising, getting good sleep, etc., but you're still not getting rock hard erections, then your health as a man is still suboptimal. That is what the lack of erections is trying to tell you. And it can be very frustrating to be doing everything correctly, or at least what seems to be correctly, and yet still experience erectile dysfunction. A lot of this has to do with the fact that as men, we have specific needs that are different from women's health needs. And trying to figure out what those needs are just by doing random searches on the internet almost always lead to poor results. That is because there's not just one thing in isolation that is important for a man's health versus a woman's health. It's an ecosystem that all needs to be working harmoniously for the erections to be coming on strong and spontaneous, which truly indicates a healthy man. When you address the ecosystem behind your erections rather than trying to focus on things in isolation, that is when you start getting amazing results. There are still men today in their 80s fathering children because erections are meant to be rock solid throughout our entire lifespan. And if they aren't, then there are alpha inhibitors that are blocking those erections from naturally occurring. We just need to remove these inhibitors from our life so that things function naturally the way they're supposed to, and we're rock hard for life, the way it was always meant to be. Now, the erection ecosystem goes into more depth than I have time to get into in this video. So I just created a brand new training that summarizes this erection ecosystem quickly so you can start making adjustments today to get the performance that you are looking for tonight. Click the link below to see this brand new training on the erection ecosystem. Click the like and subscribe button, and I will see you in the next video.